Hi, Laura. Thank you so much for coming on today and speaking a bit about yourself, firstly, introducing to our class who you are, and then speaking about relationship addiction. And if you had a client, what would you do? What modalities would you use to treat them? Thank you.
Well, thanks, Jessica, for asking me to come and speak today about this topic. It's certainly something that I've come across a lot in my practice as a social worker who does practice psychotherapy. So, just a little brief introduction about myself. I've been a social worker for almost 23 years. And I got deep into psychotherapy 7 years ago and left community services, did various jobs there, Toronto Community Housing, worked at a community health center, and also worked at a transition home for young women who are recovering from issues with substances. But I decided to do private practice, and my specialty is childhood trauma. And I do a mixture of what's called relational cultural therapy, as well as sensory motor psychotherapy, some parts work, mindfulness, and a whole bunch of stuff. So, for someone that is struggling with relationship addiction, because that's quite a controversial term, um, I would be firstly really doing a thorough assessment with this client to figure out like what has gone on in their childhood to help explain their attachment patterns in their adult relationships. So I'll get into the modality and what I would use, but what I would stress really importantly is to have, you know, time to speak to the client really in depth about like, well, can you let me know what was it like being in your home when you were growing up? Can you give 5 words to describe your mom in terms of like the relationship you guys had and your dad? And I would do what's called like an attachment interview to see like what exactly was the quality of the attachment that that person had. Um, and that is like super thorough. And we also would go and talk specifically about relationships. So we might have an entire session about like, tell me about your first relationship and how did that relationship end, and really explore that and make sure that we have a good understanding. And then in terms of modalities, I kind of do a bunch of different things depending on the client. Um, one thing is that we want is for the client to gain insight into why they're doing what they're doing and understand the motivation, and then actual tools to start to change that behavior. And so they have to really understand that, and they have some understanding because they're coming to you going, well, like this is a problem, I keep going from relationship to relationship, they're not healthy relationships, often I'm self-abandoning myself in them, or they're abusive, or the quality of them isn't great, I'm always sacrificing myself, I'm always feeling like I have no boundaries, I always feel like I'm over loving and not getting back. And you'll hear these themes with people that have major impairments in attachment. So we want the client to gain insight by asking questions and talking, and doing some parts work with this like IFS work, internal family systems, where you're really looking at that part that's trying to get connection and understanding what is happening there. And most clients that have problems in relationships or keep going into unhealthy relationships or feel that compulsion, most of the time they have serious abandonment wounds. And we want the client to understand their journey, why they have those abandonment wounds, and how they can show up for themselves. And what that means is like to really be compassionate, to speak to that abandonment, and to stop those patterns of self abandonment. So, we do a lot of psychoeducation. We practice some sensory motor exercises. That means doing some body based work, like, okay, you notice that your body gets really tense when you're by yourself, and that you reach for the phone and you go on like a dating app and you're kind of grabbing for the phone and you're kind of reaching out for that. So I do a combination of really exploring the relationship that we're having together and what that attachment means to them, some body based work to help them maybe slow down some of that reactivity, work to deepen their self compassion for themselves, and really kind of a reparenting process, right? We want the client to be able to parent these traumatized parts that are stuck in time, that are really just grabbing for stuff. So This would take more than one session, obviously. This would be several sessions. Um, and you would be tracking how the client is doing, like from the beginning of the session, like midway evaluation, and really getting them to get clear about what their goals are. So it's like, well, I don't want to keep bouncing from relationship. I don't want to do that anymore. I want to work on that compulsion. And you're gently working with that client and agreeing, you know, um, what the goals are for treatment. And ultimately, after say 6 months of treatment, they're like, oh, this compulsion isn't the same. And I actually had a client who went through this who had a history. Many people with attachment injuries also have a history of using substances or other types of behaviors that can cause them issues. And she spent 1 year. This is what she agreed, where she wouldn't have any men come into her life, and she would simply learn to be with herself, to be with her loneliness, to self-soothe. And we talked about it for a year. And now she's dating, and we're really practicing about, well, how do you feel in that relationship? Not what he's doing, not what other people are saying, but what do you feel? Well, I feel settled with him. Well, I feel uneasy that he doesn't have stable employment. I feel uncomfortable that he's drinking a lot on dates. And really getting the client to always come back into here and to honor what is happening here. And if a person can learn to do that, and be with themselves and know what they feel, then the chances are that they're gonna be able to start to identify when a connection is really good for them or not, but they gotta know what they feel. So some of the treatment plan is helping them to identify feelings too about the connection that they're in. So I could prattle away, and we're at 7 minutes, so I want to be conscious of the time. But thank you, Jessica, for inviting me, and I hope that this is helpful. And again, my name's Laura Naughton, registered social worker, psychotherapist. I also do some sound therapy practitioner work too. Thanks.
Laura, thank you. That's very insightful, and I hope our class finds it insightful too. I really appreciate your time today.
Thanks, Jessica.